Hi, good afternoon. This is Dr. Dennis Latuno once again. And today I'm going to be talking about COPD. And again, thank you for subscribing to my channel and liking my presentation. And again, disclaimer alert, my topic regarding COPD is not going to be comprehensive, so it deal with just the most common presentation, treatment. And again, if you have a sick or you're having this type of condition, you need to see your doctor right away. So also second part of this presentation, I would again try my best to translate it in Tagalog since majority of my subscribers are Filipinos from the Philippines. All right. Okay, COPD, chronic obstructive pulmonary disease, is actually either a conglomeration or combination of, emphysema, chronic bronchitis, or chronic asthma. Causes, number one cause, of course, is smoking. So if you're a smoker, you better stop right now so your COPD won't progress. Number two, environmental pollution, from cars, industries, chemical pollution too. And you have to note that 20% of COPDers are non-smoker, and they might be just a second-hand smoker. Symptoms of COPD, shortness of breath, number one. You get tired easily. You have chronic cough. You got chronic sputum production and wheezing. To diagnose COPD, again, you have a high index of suspicion from the clinical presentation, but number one test is pulmonary function test. This test is done at the doctor's office, especially in pulmonologists. They check for FEV1, which is a forced expiratory volume in 1 second, and also compare it with forced vital capacity. And number two, chest x-ray. You'll have a presumptive diagnosis of COPD if the lung shows hyperinflation and a flattened diaphragm. And number three is CT scan of the lungs or chest. It offers more definitive anatomy of the lungs and what's going on. Now we go to treatment. Yeah, number one, all patients should stop smoking if they're a smoker, and if they can't stop, you have to help them by prescribing Nicoderm patch or Chantix. And number two, they should have annual flu shot, now COVID shot, and pneumonia shot. Pneumonia shot is given times 2 doses, 5 years apart. And then oxygen, if they qualify, they have to have a PO2 or partial pressure oxygen of 55% or below, or their pulse oxy resting saturation would be 88% or below. To treat COPD, there are 4 stages: mild, moderate, severe, and very severe. And in mild COPD, you start them with short-acting bronchodilator as needed, or either a long-acting bronchodilator. Example of that is salmeterol, formoterol, and olodaterol. And usually these are inhalers either twice a day or once a day. And then, or a long-acting muscarinic antagonist. An example of these are Spiriba and Spiriba respimat or omediclinium. It's hard to pronounce. So, for moderate symptom, you do a combination of the long-acting bronchodilator and the LAMA, I'll just call it LAMA, L-A-M-A, the long-acting muscarinic antagonist. But you can also still use a short-acting albuterol for symptom relief. But for severe, meaning they have frequent exacerbations every year, you combine the long-acting bronchodilator, the LAMA, and inhaled steroid. And of course, you can still do the rescue albuterol as needed. And then for very severe, again, you do the stage, meaning the severe treatment, the LAMA, the LABA, and the inhaled steroid combination. But on top of that, you add oral steroid, and usually at this stage, they qualify for oxygen. And if you do a 2D echo, majority of the very severe patients have a condition called pulmonary hypertension. So where their pulmonary arteries are, the pressure is elevated, so a lot of them will need sildenafil, which is Viagra. You actually give it 25 milligram 3 times a day. The long-term complications of COPD is, number one, they have frequent infection, especially pneumonia. Number two, they can develop collapsed lung called pneumothorax. A lot of these are spontaneous. Usually they don't have any history of trauma. It just arises by itself. And treatment for this, they have to put, we have to put a chest tube. And number three, they develop heart problems, condition called cor pulmonale, where the right side of the heart initially enlarged, but if the condition prolongs, eventually the right side of the heart fail, and usually this will be the cause of their death, is heart failure. And then must note that oxygen is the only proven treatment for COPD to prolong life, especially if they qualify for it, meaning their pulse oxy saturation is 88% or below. All right, I hope you learned something from that, and now I'll try to translate it in Tagalog. Okay, COPD, emphysema. Karamihan sa Tagalog, emphysema. Ang mga causes nito ay yung mga naninigarilyo ng matagal na for several years. So, kung may COPD na kayo, it's best na i-stop niyo yung paninigarilyo. Pangalawa is environmental pollution sa mga factory, sa mga usok ng galing sa kotse, lalo na sa Pilipinas. Ang dami nating sasakyan na diesel. And of note na 20% ng mga COPD are non-smoker, so most likely from a second-hand smoke. Ang simptoma ng COPD or emphysema is yung nahirapan huminga, madaling mapagod, palaging inuubo, minsan palaging may plema, at parang may asthma, nagwiwis. Ang test for COPD is yung, of course, meron na kang suspicion na may COPD dahil sa kanyang history ng paninigarilyo, tsaka nahirapan huminga. Ang number one test is tinatawag na pulmonary function test. Ito ginagawa sa office ng doktor, especially pag espesyalista sa baga. And number two, chest x-ray. Sa chest x-ray, makita na hyper-expanded yung lung, tapos flat yung diaphragm. And then CT of the chest, mas definite ang makikita talaga yung anatomy ng lungs. At saka kung may damage na. And then, sa paggamot ng COPD, of course, ini-encourage namin lahat na tumigil manigarilyo or nahirapan sila tumigil, kailangan nila ng tulong kagaya ng nicotine patch or Chantix. And number two, may mga emphysema, kailangan nila ng annual flu shot palagi. Ngayon, kailangan ng COVID shot and also yung pneumonia shot, usually given na 2 beses, 5 years apart. And then, oxygen, kung mag-qualify sila, usually yung oxygen level nila sa pagka nakapahinga, sa tinatawag na pulse oxy, ang saturation ng oxygen dapat is 88% or below. Now, yung pag-treat sa COPD depende sa stages. Merong mild, moderate, severe, tsaka very severe. Sa mild COPD, usually may simptoma ka or ina-atake ka maybe once a year. Kailangan mo ng short-acting bronchodilator kagaya ng albuterol. Ginagamit mo pag ina-atake ka, and then pwedeng tinatawag naming long-acting bronchodilator or a long-acting muscarinic antagonist, for shortcut, LAMA. An example nito ng long-acting bronchodilator, salmeterol, formoterol, tsaka olodetarol. Usually, ginagamit mo once a day or twice a day. And yung LAMA, yung mga muscarinic antagonist, ito yung mga Spiriva o Respimat. And merong isa pa na bago, ang hirap i-pronounce, omiclidinum. Okay, sa severe naman, meron 2 beses mahigit na atake sa isang taon. So, ang ginagamit dito is combination ng long-acting bronchodilator, yung LAMA, tsaka inhaled steroid. Maraming gamot na may mga kombinasyon sa butika, kagaya ng Brio elliptica, yung budesonide, formoterol, and Dolera, and also yung Symbicort. Pero pag late stage na, yung very severe, combination ng sinabi ko earlier, yung LAMA, LABA, yung tsaka inhaled steroid. On top of that, dinadagdagan ng oral steroid, meaning pills. Usually, binibigay namin prednisone, maybe starting dose ng 10 mg once a day. Tapos, usually, sa late stage or very severe, they qualify for oxygen. So, kailangan nila ng oxygen. And then, pagka gagawa ka ng echocardiogram sa mga very severe na cases, meron silang tinatawag na pulmonary hypertension, yung kanilang ugat sa lungs ay matitigas na. So, kailangan usually nila ng vasodilator. Ang ginagamit namin ay Viagra, ang sildenafil, 25 mg 3 times a day. Okay, ang long-term komplikasyon ng emphysema ay madalas magka-infeksyon, especially sa baga, na tinatawag na pneumonia. So, pag na-pneumonia sila, kailangan nilang antibiotic. Tapos minsan pangalawa nagko-collapse yung lung, tinatawag namin na pneumothorax, so kailangan nila ng tubo sa baga to re-expand yung baga. And then number 3, karamihan ng mga may emphysema pag long term na, they develop heart failure. Tinatawag na cor pulmonale, yung right side ng puso nahihirapan mag-pump. Usually lumalaki muna, and in the long term nagfe-fail yung right side of the heart, and usually ito yung cause of death nila. And of note lang, oxygen is ang only proven treatment na i-prolong ang buhay ng tao na may emphysema or COPD. Okay, so I hope you learned a lot from my blog about COPD. Again, disclaimer alert, the topic is not comprehensive, and again, if you have COPD or symptoms of COPD, you need to see your doctor right away. So like and subscribe to my channel. You can message me. I will try to do my best to answer your question. And then goodbye from Los Angeles, California. Bye.